Hi there, and welcome to Let's Talk About Health. I'm Dr. Madeline Mant, and today we'll be speaking to Danielle Bourque-Bearskin, who's here to enlighten us about the life and times of being a nurse. So welcome, Danielle. Thank you so much for joining us today.
Oh, thanks, Maddie. Thanks for having me.
Absolutely. Well, Danielle, let's get into it. What is your job? What is a registered nurse?
Yeah, so I'm a registered nurse. So what being a registered nurse means is that I have a baccalaureate degree in a Bachelor of Health Sciences, specifically in nursing.
Mhm.
So with being a registered nurse, you can work in the hospital, you can work in the community, you can work in policy, you can work in many different settings as a registered nurse that a lot of the public doesn't really, understand. We have that assumption that nurses are solely focused working at the bedside, but what drew me into nursing was not being a bedside nurse, was more of the advocacy, the social justice piece that nursing has hidden within in our roles as in society. So that's kind of a gist encompassing of what being a nurse can look like.
Yeah, so I'm hearing that it can be kind of everything, which is super, super exciting. And that's why I wanted to talk to you, because I know that you would have an interesting journey to tell us about in terms of how you got into being a nurse and what kind of skills you've picked up in your training.
Yeah, so I mean, like, not only does nursing make up one of the largest workforces in Canada, my journey into nursing wasn't traditional, I guess you should say. I think for a lot of students coming from a marginalized background or from, like, not in a privileged setting at all, we definitely take these very, like, extended routes. So getting into university itself was a challenge for me. As an Indigenous student and learner, I came from a high school that I wasn't really supported into going into higher education. So I was really left out, being set up to even apply for university. So I definitely had to upgrade a lot of my courses, apply for a general studies university program and not rely on my high school marks, and enter as a mature student when I went into my baccalaureate program. So that took about 2 years after high school, which, looking back at, is a very fast route to do it, because there's many adult learners that do end up going into nursing, even like post degree. There we have in nursing an accelerated post degree program for students who have their a different degree, say in arts or biology, and they want to go into nursing. They can do a 2-year program and fast track through the nursing baccalaureate program. So once I got into nursing, I did 4 years of undergrad university, like a traditional baccalaureate program, but it's a practical degree. So you do not only theory as well as, practicums throughout your 4 years. And it's a very, very strenuous time, lots of high pressure. And once I graduated from nursing, I was kind of in this place of, like, what do I do with the nursing degree when I didn't really want to work in the hospital? Like, I'd be a hospital nurse, a bedside nurse. So in my undergrad, I had the opportunity to do some board work, some advocacy work. I volunteered for the Canadian Nursing Student Association, which is, and I'm not sure if many other, like, undergrad programs in different fields like STEM have student associations that represent them. Right. In nursing, we have one, and it represents almost or over 30,000 baccalaureate nursing students across Canada. And so we have our annual general meetings, like, we really discuss issues that are affecting nursing students. And we have stakeholders with our larger organizations like the Canadian Nursing Association, or our accreditation boards. And so that really just opened my eyes to the world of political advocacy at the policy level, and how nurses really are key stakeholders and political drivers in policy levels of, associations, but also in government, and how we are situated in actually driving certain health related policies, or in helping inform those lower levels of government. And so that really made me realize, okay, so this is the area that I would like to go into, because Indigenous health, being an Indigenous nurse, I feel, with, like, Health Canada, for example, they deliver care under a very Western model of health. Like the biomedical model is pretty much the driving factor in our healthcare system, and in Indigenous communities, specifically First Nation and Inuit communities, this model of health has failed for many years. And so with this change going on right now of, you know, delivering or giving back giving back the power to communities to drive their own services. I think I just wanted to be at that level. So that's kind of what drove me into doing public health,
Okay.
but also getting my master's degree to be able to have the knowledge and skills for that. Because as much as having an undergraduate degree is very useful in today's day and age, but when you're going into policy or any sort of higher level of political advocacy, no one will listen to you if you don't have a degree behind your name, a master's degree behind your name. So that's kind of what led me into that path. And I just went on a very extended route to your question. So
no, that's exactly what I wanted to hear. Is I wanted to, and I like picking up some of the personal aspects and some of the other interviewees, and lots to talk about health. There's been that personal and the professional side of things. I think it's really powerful to talk about the individual that is either delivering the healthcare or being part of the policy making, because it's all individuals. We you know, biomedicine and other medical systems are people driven, right? So it's coming from somewhere. So I think it's so important to have some of that personal in there. So thank you for allowing us to come along that journey with you. But I'm really interested in, you've sort of hinted at this a little bit already, but a major question I'm asking everybody is about use of language and politicized language and the importance of language. And I wondered, can you tell us a little bit about your understanding and use of words like health and illness and sickness and wellness, and how those can be politically driven?
So I think there is definitely a dichotomy going on in nursing, like between education and practice. So you have our curriculum, which, you know, lays out this very biomedical model of healthcare that gets taught to nursing students. And in that, with that language that the biomedical model uses, it really frames, you know, that individual aspect of healthcare, and using words like illness and sickness, and, you know, that we're addressing the individual and trying to fix that acute problem. And I think that's very much what the biomedical model is driven or is underpinned by, in using words like illness and sickness. And that's a very negative based way to view our health and well-being, where you have more indigenous concepts that I understand in wellness and community wellness that are driven by this understanding as a collective. Wellness is a collective ideology, and that, you know, as much as it is about the individual, like being healthy as a community drives individual wellness. And when we frame it in that positive mindset, being a public health nurse, I very much use languages like well-being and wellness versus sickness and illness, because we're focused on health promotion, right? Before we're in the hospital and this acute sickness phase where we're focusing on, okay, you're sick, you know, you have this illness, and we're trying to acutely focus on that. So being a public health nurse, I have a different frame of reference in speaking about, you know, our well-being in a very more positive frame versus, you know, being a critical care nurse, which I also work as a critical care nurse, and I switch between these frames of mind when I'm in my two roles.
Yeah. What are the challenges of that? That sounds really interesting, but do you find it challenging to be doing that switch? Is that useful for you and for the patients?
Well, I learn a lot being a critical care nurse, because I mean, like, there's just a wealth of knowledge being in a critical care setting like the ICU. And as much as I love being challenged in that role, it actually allows me to bring a lot of understanding to how the social determinants of health really influence patients who end up in the ICU. And I can say that we necessarily, in the critical care settings, don't focus a lot about a person's, you know, history. I mean, we do, but we don't bring it well enough and intertwine it into our plans of care, right? We're very focused on that acute period that they're there. We're fixing, you know, one problem enough that their, you know, their illness is, you know, shifted into a wellness, that they can be discharged home into the community kind
Right.
of thing. So, but that really helps me understand, like when we, for instance, when we have an overdose, and we have a patient that's admitted for an overdose, we really focus on that acute problem in, you know, detoxing them, getting them stable enough, and making sure that they're like, they're hemodynamically stable, and that they can, now they've detoxed this drug out of their system, and that they can be discharged home.
Yeah.
And understanding, I'm able to understand that this is very important in critical care, but also if we don't look at that history of like, why is this patient in the hospital
Yeah.
for an overdose? Like, what is their social determinants of health history, you know, their living situation, their environment, like that stuff that has led this person into the high risk lifestyle that they're coming in to us for these very acute needs, and being able to connect them up to the community resources like addictions help, you know, social housing programming, you know, and our social workers and our ICU are really great at making those connections for in that interdisciplinary team.
Mhm.
So as much as the ICU is very, we're focused on that individual, we are doing a better job at connecting resources or patients to resources in the community, and having a community health background and knowing what resources exist in the community and that people can access is like invaluable to our team, because I'm used to that working as a public health and doing health promotion and understanding, okay, so it's really important if we have a mental health client to get their, you know, accessing those needs on a consistent and regular basis, and knowing what mental health resources are out there. When I'm working up in Sandy Lake in Northern Ontario, we have a new mental health program called the Safe House. And so when a patient, before, we used to have really young teenagers or individuals come into our nursing station in a mental health crisis, actively suicidal, and we would used to just keep them in the nursing station until we can get them medevaced out of the community for help. But that places a lot of resource strain in the nursing station, because the 24 hours of care waiting for the medevac out. And so we saw it was a really huge need for the community, that we needed some interim housing for these individuals, that they could go for 24 hours and have 24 hours of care until they could be medevaced out of the community. Because if they're immediately a harm to themselves, the suicide rates in our Indigenous communities are so incredibly high that we have to take these like very drastic and immediate concerns, because it is a problem. It's an epidemic in our communities. So having the resources in that, like, I know what our communities are capable of achieving when we have the resources there. And being in us working in Southernly, when I work in the southern province of Ontario, there's so many more resources here for our community. So like having, like, it's such a divide in roles that I do public health and critical care, but they are married in the same way. It's just, you know, we live most of our life in the community, and we're like spend a very small percentage of time in an inpatient hospital, if ever.
Right.
So yeah.
No, that's super interesting, and I was really interested to hear you use the word team there several times in terms of the idea. It sounds like there's room for teamwork, and there's room for dialogue, and room for many people to be involved in this more sort of the long-term care you're talking about.
Yeah. So in any role that I have worked as a nurse, it is not. I've never felt like I wasn't part of a team. And
Okay.
like that's the role that we are. Like as a nurse, as a registered nurse, and pretty much any setting you work in, it's a team. It's a teamwork environment. You have interdisciplinary care at many like stages within the like life continuum of our patients, that it's like, if we look at just, I'm the nurse and this is my role, like, you know, we're doing an injustice to our patients, because I can't do everything. Like, I'm not a trained social worker. I mean, like, I can have really great discussions with my patients about their wellness and blah, 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 but I also don't know about the up to date like programs that go on in our communities all the time. It's because it's changing, right? And social work is so great that they're able, and then our, like, you know, our intensivists in the hospital, our ICU doctors, and then you have our physiotherapists that are there, able to, get our patients up, ambulate them, walk them, make sure that like, do these assessments to make sure that they can even like function at home. Like that's, you think of physio being like, healing a sports injury, but they're so critical into making sure that our patients go home and making sure they're not going to have another fall at home and come right back to us. And the same thing goes with OT. They work alongside in the hospital and in the community as well, doing those same assessments in-house, making sure that their houses are, like okay for the types of disabilities that they currently have, or like deficits or in any such way. And then you have our dietitians that you're making sure patients are eating or like they have access to food. And so it's just like, it's this big web of people like that you wouldn't even realize for one individual, making sure that all of these needs are met before they can even leave the hospital. And it's the same in the community, but in a different way, because we're health promotion mostly in communities when we're talking about like, going into a clinic and making sure we're trying to prevent a lot of these acute care problems that would end a patient up in a hospital inpatient. So like it's just a different approach that we take.
Yeah. Now, you've provided so much fascinating information, and I love the idea of this web of support that's there for people. But what advice would you give for somebody who was specifically interested in pursuing nursing as a career?
I have so much advice, but
Yeah,
like
good.
I think as a healthcare provider, my biggest advice is to understand that like even as a registered nurse, we have so much power in our roles as healthcare providers. A lot of people always say how we're there for people in their most vulnerable times, but with that power, we have a lot of ability to do harm on not only the community, but individuals. And
Mhm.
so just recognizing that our own biases and our own belief systems can really cause harm on our patients and the community, and that we do have the ability to cause harm, but we also have the ability to like impact someone's life in such a
Mhm.
powerful and profound way. And so my advice is just to recognize that, like not to be cliche, like with great power comes great responsibility, and that we need to recognize that like we're not on a moral high ground because we're nurses. And I think the image of nursing is that we're these benevolent individuals that can do no harm, and we can. And so like pursuing nursing is a very challenging and rewarding career, and you can do so many things with it in so many variety of settings that you know it's just amazing.
It sounds absolutely amazing. And I want to thank you so much for giving us your insights and tracing so much of that personal journey as well. I think it's a really powerful message that there's lots of different ways to get into healthcare, and there's lots of different roles one can play, but that it's tough, but good is sort of what I'm getting from this. It's a
Mhm.
challenge, but it sounds like it's really, really rewarding as well. So I want to thank you so much again for being here today. And thank you also to our audience for tuning in. And I want to say thank you everybody for your attention, and we will see you next time on Let's Talk About Health.
Bye.